Hello, this is Gerard. I'm from the Netherlands, but I live a long time, more than 30 years in Brazil. And I had a problem with my health, and thanks God I came to this hospital, which I forgot to tell the name because it's so complicated. But I know that's one of the A hospitals here, and there has been done a bypass operation of 3 bypasses, and one was completely four, and one was completely blocked. So I was helped very quickly, and now I have to recover. And I got besides the heart operation, I got now a prostate problem. I want to get rid of the prostate. I'm already 69 years old, and I will do the operation here as well after 2 weeks, because I cannot operate shortly after the heart operation, because it's a very big operation. And as soon as I have that done, then I will be going back to Brazil in about 2 months. And so in the meanwhile, I will stay in the City of Joy. I want to see the Eco Park, I want to see the Science City, I want to see the Big Ben, I want to see the restaurant above the roads and everything. Mother Teresa, I thank the doctor that he did a very successful operation. Of course, he saved my life, of course. How can I forget to thank him a lot? I will see him when I come back, but I recommend everybody who sees this video to do the operation here. I heard that many people from outside India come to here, because this is a concentration hospital, which is specialized in cardiac issues. So please come to this hospital. I recommend it. Thank you.
I'm Dr. Lalit Kapoor, cardiac surgeon at RN Tagore International Institute of Cardiac Sciences in Kolkata. Naturally, being in Calcutta, we operate a lot of patients from Calcutta and the surrounding states. Off and on, we get patients from distant places. And I was surprised one day in my OPD to have a visitor. It was the wife of a patient. She herself was a Brazilian, and she had come here with somebody from our office staff to tell us that she has a problem because her husband was admitted in another hospital with a heart attack. Her husband was a Dutchman, basically a Dutch, but they had migrated and he was staying in Brazil with her. He used to come regularly to India to work in the tea gardens, or had some interest in the tea business of India, and they used to probably export or import tea, but I'm not sure. And on one of her regular visits, this was one of their regular visits, he developed a heart attack while he was staying in some part of town. With this attack, he got admitted in a local hospital and was managed for a couple of days, a lot of expense, and they felt that the treatment was probably not getting anywhere. Out of fear and apprehension, she came to our hospital, and frankly, she looked extremely scared and disconcerted, worried. She almost as though she had no hope. So it was a very awkward position for me to explain to her that it's not a problem, because her husband had just had a recent heart attack and an angiogram had shown triple vessel disease. With the ejection fraction was very low, the heart was pumping at only 30%. So I had to convince her that he needed an early surgery, which she wanted to do. But again, her previous apprehension and experience, as well as the financial problems of working through the insurance system in India, were worrying her. Fortunately, our hospital was very considerate and managed to help her out in all her administrative and financial issues. And then we went to see the patient himself who was admitted. And after admission, I saw him. And I was quite surprised to see a person whose heart was quite bad, but himself looking pretty good. He was very cheerful, very positive. And I think in a way I may have been supporting his nervous wife. It was very good. And but I knew I did had an echo done in front of me, and that showed that all the findings given to me were true. He had a very poor left ventricle, and the angiogram looked quite bad. we went ahead with the bypass surgery, and like is the usual norm for me, we did a bilateral mammary internal total arterial grafting, and patient did extremely well post-operatively. In fact, so much so that on day 2, he was very upset that we had not yet shifted him to the ward when he was still in the ICU. Well, anyway, we shifted him, and then after that, he had a very smooth and nice recovery in the ICU, in the ward, I'm sorry. And he was ready for discharge. And the day of discharge, we went to just say bye to him and give him his post-operative advice. I was surprised. My normal job is to actually treat patients and heal the heart. And here was this man who was so cheerful, so entertaining, so positive, and he in fact treated my heart. All my concerns and worries disappeared for those few moments while he was talking to me and being so cheerful and happy after his operation. He was putting on masks and showing us like a little child of, he was enjoying the moment of sort of getting back home after this surgery. I think he won my heart that day, and I wish him luck for his journey from here on.